Welcome, welcome, welcome. It is so wonderful to see so many folks on this Zoom this evening. I am Dr. Sharice Hamblin. I am an OBGYN at UMass Memorial, and I'm so excited to be here. One of the things that we have done at UMass is build a bridge or something. Basically, I'm also at Memorial as an OBGYN in a wonderful department, but I'm also at the medical school with a collaborative in health equity. I'm going to tell you a little bit about what that's all about, and then Dr. Aloko will tell you about our wonderful program, and we'll have open time for you all to ask questions. And we have some wonderful faculty and residents on the call. So before we get into presentation, I'm just gonna let everyone introduce themselves, as far as especially the UMass folks, just so that you know, some people like to ask questions by a direct message via the chat as opposed to, asking it out loud, and that's fine. So I just want you to know who you're with. Everyone here is very unassuming, and so they don't even say Dr. So and so, but I do want you to know who's all in the room. Dr. Loco?
Sure. I am Liz Alaco. I'm the program director here at UMass. I'm one of our generalist OBGYNs. I'm very excited to see all of you here. Thank you for spending your Thursday evening with us. I see Dr. Kumara Swan.
Hello, I'm Dr. Tara Kumaraswamy. I'm the Associate Program Director and I help train in complex family planning. And at some point, I have to go pick up a prescription, so I will be off camera as I drive. But I would love to talk to anybody who has any questions because this is a great place. Thank you.
Hi, everyone. I am Ty Fraga. I am newly an educational consultant for UMass. However, I was there for over 20 years, working in the clerkship and the residency, and so I've got years of experience. I moved to the South for a little bit. I'm still living in the South, but I am remotely working with my favorite OBGYN residency program.
Awesome. Now it's hard. There's many joining and coming off. I'm going to get us started with a couple of slides, and if I missed
Oh, Dr.
someone,
Hamlin, do you mind if I just let we have some interns on, or at least an
please.
intern on,
Absolutely.
have them introduce themselves?
Hi, everyone. My name's Carly. I'm one of the UMass interns. I will be joined by many more of my classmates and I think more residents as well after they finish 6 p.m. sign out. So everyone's sort of in the middle of things, but I had the chance to log on. So it's nice to meet everybody.
Wonderful. Yes, I am again so excited to be here. I'm gonna take my moment and then turn it over to Dr. Lucko, and like I said, we'll definitely have time for um, questions. I'm just going to tell you a little bit about the collaborative and health equity. I think this is one of the cool things about UMass, mainly because a part of it. But what it's done for the OBGYN department, and that's what I really want to get across and share with you. So I'm going to jump to a couple of slides. Main things are medical school. Um, the medical school's strategic plan has some very lofty goals, and it's actually in the process of creating a new strategic plan. But I did want to point out to you that global and community impact, translational research, operational excellence, and diversity, equity, and inclusion are part of the strategic plan for the institution. The Collaborative in Health Equity is this wonderful team here. As I said, I'm a part of this, and thank you, Sammy, for all of the hard work that you do to make sure that things come together. Um, Again, if you didn't notice, the Collaborative Health Equity, two of the doctors there are myself and Dr. Krista Johnson Obaku, both OBGYNs. And so the collaborative gets to work very closely with the OBGYN department because we have proximity and line of sight. So we've been able to do an amazing set of programming for Black Maternal Health Week. And the idea with the collaborative is that we bridge some of the divide or bridge some of the connection between UMass Chan Medical School, UMass Memorial Hospital, and the Worcester community. So we've had some really amazing times, and this is an example with Worcester for Black Maternal Health, where various different organizations, instead of kind of competing with each other to showcase what we're doing, working together to have maximum impact in the community, as we were talking about, are focusing on Black maternal health. Uh, some wonderful pictures of programs again. Shout out to Sammy. One of the things that I've done with the collaborative and the OBGYN department support is to have Sunday dinners. And so thinking about when you're in a new place and you're trying to build community, a lot of times you might have a sense of community within your residency program, but to have crosstalk between different departments, training, the medical school, students, staff, we've been able to create this space and have had many wonderful times together. The OBGYN department also has some great things like an annual welcome event at Dr. Morsimus, our department chair's home. My kids come to everything. I think you might have just saw Max. Pipeline Dreams is a high school student enrichment program that I've brought to the institution, and many of our residents, faculty, and others in the department and outside of the department have been helpful and supportive and giving exposure to high school students. So there's lots of opportunities to get involved in things. If mentorship is part of your previous experience with a low commitment, it's not like come here and start a whole new program. Like there are things that are turnkey and ready for you to pitch in where you would like to. Um, and we've had many wonderful times. It's just lots of wonderful pictures. So you will see learners here. Obviously, we work with medical students, but also you would see younger people like high school students at various programs. And again, as a resident, you'd have the opportunity to participate in any of the things that I'm doing. And with that, I'm going to turn it back over to Dr. Olako, tell you about our wonderful program.
Thank you, Dr. Hamblin. I just love all your pictures. I'm going to here share for you. I'm going to give you a quick overview of our program. We're going to start just with our leadership here. I want to give you a quick overview, give you all a sense of who we are, where we are, and what we love. And then we will have lots of time for questions at the end, and we really look forward to hearing what you're interested in knowing. So this is our leadership team. I'm the program director. Dr. Kumaraswamy, who's on, is our associate program director, and Dr. Shabbat's our assistant program director. We all also did our residency here at UMass, so we know and love the program very much. Dr. Ty Fraga is our education consultant, doing a lot of work with us to make sure that our formal education is up to par. And then Shirley is our program coordinator who keeps us all on track and makes sure the program can continue. We really want to train our residents to become confident generalist OBGYNs. It's really important to us that our residents can then launch into their generalist career or into fellowship. And we have about 40% of our residents end up going into fellowship, but with a really, really good foundation of generalist practice and exposure to all those subspecialties so that they can make decisions about what they want their career to look like. We firmly believe in equitable and patient-centered care. This is a common theme throughout all of the interests of everybody in the department. We really believe in a harm reduction approach to care, and it comes through on our obstetric and gynecologic services, and is really at the heart of the way the residents practice medicine, which I love so much. We give our residents skills for lifelong learning and evidence-based medicine and really develop relationships with our residents and a sense of collaboration. Many people continue to work at UMass. Many people go elsewhere and work with other former residents. So we do develop a really nice family here at UMass. This is our graduating class from last year, 2 of whom matched into family planning fellowship and 3 of whom are working as generalists at places where there are learners. We're in the center of Massachusetts. We are at the second largest city in New England. We really have a very wide geographic area that we cover in terms of providing care to patients. The whole central third of the state, and also including some of southern New Hampshire and northern Connecticut. There are a lot of people in central Massachusetts, and we're the tertiary care center. So we're fortunate to be able to care for a really large portion of the state. Our clinical sites are very close together. Our primary site is at the Memorial Medical Center, and then our residents also do some rotations at the university campus where the medical school is just down the road, day surgery center, Planned Parenthood, and St. Vincent's is a community hospital. All of these are within a 10-minute drive of each other. It's very easy to get around. And I would say most of our residents live also in Worcester. Sometimes residents, if they have partners that they're splitting a commute to Boston, they'll live a little closer to Boston, but the majority of our residents are pretty close in this area. We have 6 residents per year. This is actually relatively recent for us. We recently expanded and it gave us an opportunity to do some really cool things with our schedule. The residents in general have 12 blocks per year. They do use a night float system from Sunday to Thursday night with 24-hour call on the weekends. We try really hard to get the residents exposure to the subspecialties in the first 2 years of residency so that they can start to develop relationships with subspecialists. They can decide if that's what they want to do for their career. And also so they have good knowledge of the subspecialties, because that's very important as a generalist to know who your colleagues are and how you can all help each other. And so we have a very close department in that way. We do use a swing rotation for backup, so that allows us to send people away on vacation and they don't have to worry about their services. Everybody else will be okay for the time that they're gone. And we have an elective that we put in the PGY3 year that is used for many different things. A lot of our residents do away rotations. They might concentrate on research projects, do a surgical elective. There are lots of different ways to construct the elective, so that's very individual to each person. I'm going to take you through the services really quickly to just give an idea of how the residents work with each other. Our OB inpatient service has 4 residents, one from each year. We let you hit the ground running, and we really want you to get in and take care of people because we know you've been studying for so long and you really want to get in and do clinical care. So as a PGY1, the interns are taking care of low risk patients, but doing primary cesareans, postpartum tubals, doing vaginal deliveries, really getting out and about on the floor. And they have excellent support from their seniors, and who are also taking care of more high risk patients, doing more complicated surgeries, and managing the antepartum service of patients who are admitted for medical or pregnancy complications in the hospital. And then the PGY4 is the boss of the service. So they get to run the floor, chief deliveries, meaning that they can act as the supervisor for their junior residents during vaginal deliveries, C-sections. And this also occurs on their GYN service, and then provide some consultative services. We do about 5,200 deliveries per year. This is the only site at which we do obstetrics. We do have help from a triage and postpartum rounding team. We have a level 3 NICU and many other services at the hospital that allow us to take care of some complicated patients, both birthing people and their babies. And so we can take care of almost anybody at UMass, which means that you get really good at providing complex care and can really be exposed to a lot during residency. Of course, we never want people to have complications, but we want to be able to take care of them when they do. And like I mentioned, we're the referral center in the area. Our MFM division plays a big role in our obstetric service. They run the inpatient antepartum service and ultrasound and testing. They also manage several specialty clinics that are both seated within the residency continuity clinic and outside of it. And that includes a high-risk clinic, a diabetes clinic. Fetal specialty clinic is for people whose pregnancies are complicated by anomalies. So there's lots of exposure to different MFM areas. And we do have a fellowship with 1 fellow per year, which adds a lot to the resident experience, as the fellows are excellent teachers and really, really love working with the residents. On GYN, similarly, we want people to get into the operating room. We want you to get down in the emergency room doing consults and seeing patients on the floor. So our interns are doing a lot of hysteroscopies and more simple laparoscopies, managing the quant book for patients with pregnancies of unknown location. And then they move up in their second year to doing some more complex laparoscopies and open surgeries. And as a chief, they're really doing those teaching cases, but taking care of major surgeries, running the floor, and being the first point for their juniors in sorting through plans for patients. Our GYN surgeons do a mix of open surgery as well as minimally invasive surgery with vaginal, straight stick laparoscopy, and robotic surgery. We do have several MIGS faculty who do primarily minimally invasive surgery. We have a PA who helps manage the floor and consults, and then also one of our residents is designated as somebody available for consults and seeing patients in an urgent clinic where there are a lot of procedures and surgical planning. Our generalist division does a lot. I am partial to the generalist division as I am a generalist, but I think that we do a great job with helping the residents out on labor and delivery. In the GYN OR, we're pretty busy. We have a lot of people who love to operate. We also supervise the resident continuity clinic for the majority of those sessions. So we get to spend really good outpatient time with the residents. We do have several subspecialties that are housed within the generalist division. So I mentioned we have a few MIGS providers. We have one of our docs is in PD adolescent GYN, and the residents get to go spend time with her in clinic and in the OR, and then also our family planning attendings. And we do also have two very large private generalist groups who the residents work with and do things in the hospital like cases and deliveries with just as much as the faculty group. I think this is really nice because it gives you an idea of what it's like to work in a slightly different practice model. And many of the people in those private groups did their residency at UMass, and so they chose specifically to stay and work with residents and medical students, and they love to teach. And so I think that's a big asset, those close relationships with the private groups. I mentioned family planning just because it's of interest to many. We do have a dedicated rotation where residents get to help with pre-op and post-op clinic at the family planning clinic at the hospital, but then also go to the Planned Parenthood here in Worcester. And in both locations are able to do options counseling, medication abortions, and procedural abortions. We are an opt-out program. We're fortunate in Massachusetts to have a lot of legal protection for family planning care, and our family planning services, while they're concentrated in this rotation in second year, are also present throughout the entire residency. So we see patients in continuity clinic all the time who have family planning needs. And similarly, in our faculty clinics, we see patients very often. So the family planning services are not limited to this rotation. Our GYN oncology service has 3 members at a time, a PGY2 and then PGY1 later in the year, who are spending some time in clinic and getting into the OR to learn how to assist primarily with the robotic cases. And then the 3 and the 4 do a little bit more floor management and are absolutely in the operating room all the time. The oncologists do some really big open cases. They do a lot of minimally invasive surgery with the robot. Our oncologists also provide chemotherapy to their patients. So it's really a very comprehensive view of GYN oncology. And they have a very wide geographic area that they cover in terms of care for patients. And then our urogynecology service is the residents see that in the second year and fourth year. We do a lot of vaginal surgery, a lot of robotics, and our residents get a great outpatient experience where they're learning about incontinence management, pethary management, and learning how to do a prolapse assessment. This is all so applicable both for people who want to do urogynecology and also generalists in the clinic. This is a really important piece of learning gynecology. Our urogynes also have big research and big interests in quality improvement. We do have a fellowship, and so similarly, the fellows and the residents work well together, each complementing each other in clinic in the OR. And here also our REI division. The residents go to REI in their first year and fourth year, and they're doing outpatient consults, a lot of GYN ultrasound. You get really good at GYN ultrasound in your intern year, sitting and reading all of the scans and working with the sonographers. And then our REI division also has an on-site IVF center. So in REI, you can participate in IVF procedures. Our continuity clinic is the CWC. It's fantastic. I love the CWC. We provide a lot of routine OB and GYN care there, and we do have some specialty sessions for urgent clinics, so patients who oftentimes need follow-up from the ED and might need procedures, might need surgery. We have a new this year a preventive care clinic. We have a pre-op and post-op clinic that's also relatively new this year, seeing patients before they have surgery to make sure everything is optimized and we have a good idea of what the surgical plan is. And then colposcopy and LEAP as well. Those are big procedure clinics. The residents this year are grouped by level. This is also a new thing we're trying based on resident feedback. So the interns have clinic together on Thursday afternoons, actually. I hope they had a good time this afternoon. Um, and then the twos, threes, and fours all have sessions together as well. And I think this is turning out to be pretty fun and great for learning. And I think is also just a reflection of how we try to adapt the program to what we're seeing, what feedback we're getting, so that we can be flexible and continue to change and learn how to have the best program. The residents that are the interns are also doing an outpatient rotation this first half of the year to get used to doing clinic and doing solo and buddy sessions with their seniors to really get their feet set because clinic can be really difficult to just be thrown into all at once. So I did mention that we have the subspecialty rotations early in residency. Here you can just see where all of the different subspecialty rotations are located by year. So a lot of them run through all 4 years, with some of the other rotations more specifically being like family planning in the second year. But this gives people some good exposure, allows the seniors to revisit the subspecialties before graduating, and gives you a really good foundation. Our didactics are 3.5 hours on Wednesday mornings. It includes grand rounds. We have a variety of speakers from inside UMass and also from other institutions. Our grand rounds, I think, are pretty excellent. Always interesting topics on obstetrics and gynecology. This week we had one of our private docs give a lecture on pain control or perioperative pain control approaches for patients with substance use disorders. We also have advocacy sessions. We have a research day with a research speaker, education sessions, and our monthly quality and safety rounds, which is like our version of the M&M, where we review cases and also think a lot about the social inequity factors that played into those cases. And then the residents go to lecture, where this year we're concentrating on a lot of fundamentals of OBGYN. There's some research sessions thrown in, and we do SIMs that are scheduled about once a month. There's a nice hysteroscopy SIM at the beginning of the year. We have vaginal repair shoulder dystocia sims. So we try to do some more hands-on learning. And then they also get some time to do admin tasks and also to talk with myself and our chair, which is part of how we get all that feedback to adapt the program as we need to. So that's been really nice to see everybody in one place so frequently. One of the things I really love about our department, and this includes all of the residents as well, is that everybody has their interests. They have clinical interests or academic interests, and they're all pretty complementary. So I would say one common theme is care for marginalized group of patients. And that shows itself in the Rainbow Clinic, which is more like a virtual collaborative of providers across the institution taking care of LGBTQ plus individuals. One of our GYN surgeons does a lot of gender affirming hysterectomy surgery. Um, there's a Green Clinic, which I staff, which is taking care of people with substance use disorders in pregnancy and postpartum, big interests in perinatal mental health. We have really heavy use of interpreter services. We have a pretty diverse patient population in Central Mass. And so the interpreter service has been, and availability of it has been a big push from our department. Um, Dr. Hamblin mentioned the collaborative and health equity, of course, and Dr. Johnson and Bakwu. Some of the things they put on include the Black Maternal Health Week and a lot of global health seminars. And then Dr. Hamblin didn't mention that she runs also a doula program here. So Dr. Hamblin got started up a doula program specifically to provide care to Black birthing patients with the goal of decreasing disparities, providing more equitable care given the disparities in maternal morbidity and mortality. And that I think just passed its first year anniversary and is amazing.
Yes, 100 and or maybe 180 births have been supported through this program.
So great. Our residents are very well supported to do state and national advocacy. And, you know, some of this advocacy is why things like our state insurance covers doula care, which is phenomenal. But our residents go to DC, go to the State House, participate in the ACOG advocacy days, and we're able to support them doing that. And then also their big interest in the department in medical education, professional development. As we have our residents and then our medical school, we are quite invested in providing a good educational experience to them and always thinking about ways to modify the curriculum. These are just some of the interests. There are so many clinical interests scattered throughout this department. Honestly, you could find somebody to talk to you for an hour about anything in OBGYN. That is all I wanted to tell you all about as an overview of our residency program. These are the residents went picking flowers on their wellness team building day earlier this summer. Um, and they had a fantastic time. But I do really love our program. I think we have a great program, and we would be happy to hear what questions you have and let you know what we think about anything about our department. I can see we've gathered more interns, which is fantastic. Um, and whatever questions you have, we can help you find an answer.
So please feel free to come off of mute, introduce yourself, and ask your questions.
Everybody's from all over.
Hello. I don't know if you can hear me. Yes, okay, hi. I'm Taylor. I just wanted to ask, can you all like break down the call schedule? I kind of get confused with really any type of call schedule since I've never done it before.
Um, Carly or our other interns, do you want to describe your call schedule?
You can do it.
Yeah, we would love to.
Yeah.
So I think this was sort of outlined in one of the slides, but this was very confusing to me, I think, before getting into it as well. So it's a really good question. So our call schedule, when you are on call on the weekends, you either work Friday night and Sunday during the day, or you work a Saturday 24. So whatever rotation you're on is kind of what happens for your Monday to Friday schedule. And then if you're on call on the weekends, you either are on Friday night and Sunday or a Saturday 24, or you're off for the weekend. And so I think it typically works out when we're on days that we work 2 weekends a month and then have the other two off. And then you don't work weekend call when you're on a night's block. Or some of our off service rotations where the schedule doesn't line up right.
Yeah. And then just to clarify that it would be a 24-hour shift on Friday and a 12-hour shift on Sunday, or a 24 on Saturday.
Yeah.
Because I didn't understand that.
Yeah, that part is confusing because you are there during the day on Friday doing whatever it is, whatever rotation you're on, and then your like call part of your shift starts at the end of the day.
At 6 p.m.
So at 6 p.m. it goes overnight. Yeah. And as an intern, when you're on call, you're always on labor and delivery doing like low risk labor and delivery things. But every year has its own sort of role as part of the call team.
Perfect. Thank you so much.
Yeah, absolutely.
Hi, my name's Akila. I'm from Michigan. I just wanted to ask a quick question. Thank you so much for the amazing presentation, by the way. I just want to ask, do you guys have midwives that you work with in your program? And if so, what does your interactions with them look like?
We are Our midwives right now are working on the triage postpartum rounding team, so they are on the floor um, mostly every day during the day and most nights also seeing patients who come in through our triage is like the emergency room area for pregnant people. We don't right now have midwives delivering on the floor with the exception of there's a midwife in one of our private groups. Um, that might change sometime over the next couple of years. But right now, our midwives inpatient are in triage. We do have several midwives who also, maybe not several, but we have a one midwife who works outpatient in the faculty clinic space as well. So we're starting to integrate midwife care a little bit more, but it's not fully there on the floor.
Okay, thank you.
Hi, I'm Cami. I'm from South Carolina, and sorry, my dog is taking this opportunity to sleep on my lap. Um, I wanted to ask if you guys were anticipating any changes in the next few years, or if there's anything you guys are excited about that's starting up. I know you mentioned that the doula program is like a year old now. Do you have any new initiatives or anything that you guys are excited about that's starting soon? Or any other changes that'll be happening over the next several years?
There are always changes. I have a couple of things I can talk about. Dr. Hamlin, do you have anything on your mind?
No, just I'm trying to, me personally, I'm trying to get my youth back.
Hi, I just popped on. I wanted to
Oh,
introduce myself really quickly. I'm Des. I'm one of the PGY3s. I just was able to, hi. I was just able to get down to a computer and turn on my video, but I can take the lead on some of that. I think one of the things that just came to mind, I just met one of our new attendings, faculty attendings, Dr. Robinson. She is trained in MIGS or minimally invasive gynecologic surgery. So I think one of the cool things that we're seeing now is we're having a lot of new faces from places outside of UMass coming in. I think it'll really help build up the robotics portion of the training that we do get here at UMass. So that'll be an exciting new thing that's coming in, and we'll see how that goes. And then I think there's a hand raised by Abigail if you wanted to.
Hi. Yeah, I'm Abigail. I'm from Chicago. Mine is kind of a piggyback and a two-part question. I was particularly interested if you had, I know you talked about your Black maternal health programs and community integration, which is amazing. I was wondering if you had any community integration programming with teens and youth population besides the mentoring, like with education-wise with health going on, and what your exposure is with PAG. I saw you had some subspecialty attendings, but I didn't see it like in the rotations for exposure.
Oh, hi guys. I can introduce myself. Hi, I'm Katie McCarthy. I'm a generalist and PAG provider. Rotate with me typically when they're as part of their REI rotation, and get some clinic exposure then, and then also longitudinally throughout their GYN rotation will join me in the OR for cases. So there is some direct work with PAG that way, and then also through didactic sessions and things like that. It's nice
Yeah.
to meet you all.
And then we also do some like day in the life, um, days of where we have like high school students come in, and we talk to them about how it is to be in OBGYN. We get them hands-on training with really everyone that's a part of the OBGYN team. So anesthesia, they learn how to use the ultrasound, they do some suturing, learn how to scrub into an OR and what we do during residency and what other auxiliary staff do as well. So
Yeah, I'm answering something in the chat, but the point, I guess, when you think about where the collaborative and health equity also steps in, lots of programs and everyone has different passions. And so, ideally in a residency, you're able to pursue some of your passions, either things that you were involved in before residency or that you get involved in when you're in residency. But what happens when that next rotation comes and it kicks your butt and now you're not able to do that thing? And so when we think about showing up for community, it's really important to be consistent. And that's where I think that the collaborative and health equity, which is on the school side, is really helpful because it's kind of baked into the how do we do work that continues on, whether whether it's works for a person's schedule or not, and work with community organizations that are on the ground every day. So yes, we can do these things where we have a great feeling, but then the work continues on with other programs that are more community based.
Thank you.
I think in the order that hands have showed up for me, is Caitlin next.
Hi, my name's Keelan. I'm from Temple University in Philly. So I had a question more so for the interns in talking about your experience with the transition to residency. So like how did orientation go for you all? And how did you feel supported by the program to make that crazy transition that I'm still in shock that is so soon for us?
So I guess I can take it. Hi everyone, I'm Ene, one of the interns. So I think this UMass does a really good job in easing us into residency. At the start of, or rather by like July 1st, we do this thing called immersion where we do 3 weeks of all the major like services. So 1 week on gyne, 1 week on OB days, and 1 week on nights. And also you are paired up. So everything is a two-person job. And so you don't feel by yourself. And yes, you will feel stupid. I did feel stupid. It doesn't matter. Everyone is here to help you and teach you how to put in a Tylenol order, how to put in like a Pitocin order. Like they literally like hold your hand through every step of the way. And so um I think compared to other programs, I think like UMass does an amazing job in kind of like easing us into things because we don't all start on gyne, we don't all start on OB. So by the time we get to OB or even before our first call shift, at least we have gotten our feet wet and kind of know what to do to like some extent. And all our seniors have been amazing, have been so great. And I have never felt scared to ask them any question, whether I've asked them a million times, like, sorry, how for the millionth time. I'm sorry. So yeah, I don't know if anyone else wants to chime. I can add something. Hi, I'm Tiffany, also one of the interns. Sorry, she's down Probably there. got that at this point.
Trying to get a better
Yeah,
connection.
I'm on the floor. But I think another great thing that we experienced is that we had like a support chief during L&D days. So this was just like an extra chief on the service that you can ask all your like silly questions to, even though it was reinforced that there were really no silly questions at this stage. So we had an extra person that could help us put in orders, or if we were told to do something that maybe we hadn't done before, they could kind of walk us through it. If we need to do cervical checks, right, and we need a back check, she could kind of come along with us and do it with us so that we're not disturbing the chief from like the chief duties of like managing the floor.
Thank you so much.
Yeah, of course.
You want to get
Next, I see Jade.
Hi, everyone. My name's Jade. I'm from Tampa, Florida. And thank you again all for being here. I kind of am going to follow up on something that's already been talked about is just, intern and resident passion projects. And I was wondering if you guys could speak a little more to specifics about ways that you're able to get involved in that, including but not specifically research interests as well.
Des, do you have um
Sorry, I heard intern, so I tuned out.
oh, and I'm sorry. I
Um,
also and I apparently tuned out the word intern.
sorry, what was the question again, Jade?
Sorry, kind of just wondering what the scope is of, different research projects or being able to initiate any personal passion projects that you have throughout intern year and residency as a whole.
Got it, got it. Okay. I think what's great about our program is that UMass kind of meets you where you're at. So there are a lot of residents that are um, interested in doing fellowship or just very interested in research and have a lot of questions. And you can find a mentor very easily. You can kind of just ask our attendings, like, what are you working on? You can do some research online. I think we don't have a formal mentoring, like research mentoring day or like way of kind of getting connected, but we do have a formal research requirement for the residency program. So it's easy to identify a resource and a research mentor. And then we kind of just follow along each year. So first year, you identify a mentor, maybe just think about a question. Your second year, you're kind of developing a proposal for that and presenting it at the end of your second year to your class, the other residents, as well as the faculty. And it seems intimidating, I know, because I just did it, but it's really just a good way to practice kind of like verbally describing like what you're interested in, what your plan is, how you plan to do that, and then getting feedback from everybody before you're initiating the, IRB and like research collection and data synthesis and all of that. Your third year, you do a formal presentation of the completed work, and then fourth year, you can continue. So all in all, I would say getting getting your hands onto a project is fairly simple. It's just a matter of how motivated you are to start early. But everybody does graduate with a research completed project.
Thank you so much.
Mhm.
I just wanted to quickly add also during intern year we get a 1 week for research. And so for me personally, I was able to kind of talk to one of the attendings that I work closely with to think about, several projects that they already have going on. So it is very easy to kind of latch onto a project that's already started, or if you have your own ambitions of a certain project, to talk to someone and kind of get that get that done.
Thank you.
Mhm.
You all are asking great questions here out loud and then also in the chat. And I know we're going through the chat questions as well. I see Moira next.
Hi, my name's Moira. I'm in Columbus at Ohio State. I had asked a question in the chat, but wanted to follow up, and then I also have a second question. So I asked about global health, and I saw that there's some programs in Rwanda and Kenya. Are people also able to kind of like create their own or like go to other places? Or is
Yeah.
it just those two established?
Those ones are established, but I know there's one chief now that during her elective, she went to Kenya for a project that she had already started up and was following up on. And it's very easy as long as if there's nothing established, as long as you kind of create the plan, and propose it, and then it can just either be approved or just ask for more elaborate detail on what you want to do. That is a way to get involved. Many residents use their elective or 4 or 5 weeks to, if they're interested in doing fellowship, doing an elective somewhere. So this December, I will be doing an elective. And it was just a matter of reaching out to a program, getting that approved, and then coordinating with UMass, with our program coordinator, Shirley, and our PD to get that done. So there's multiple ways to go about it. You can do a formal, like an already established thing. You can come up with your own, or if you want to do like an elective at a program and a OBGYN program, you can do that too.
And just another resource with global health, the medical school doesn't have an office of global health, but the collaborative and health equity, one of the pillars is global health. And so creating like here's the process that you need to do for going away. And so obviously I see medical students doing that, but that's a resource as well for residents.
Thank you. And then sorry, I have one follow-up. I was wondering like where residents live and what life is like living in Worcester.
Yeah. So I live in an apartment complex in downtown Worcester that a lot of residents in the past have lived at, and they still do. So it's pretty affordable and amenities if you're a little bougie like me, and it's pretty close to the hospital. It's about like a 5 to 10 minute drive, depending on how desperate you are to get to the hospital.
Yeah, I feel like people kind of live all over Worcester in like apartment complexes, houses. Like I live in like a apartment that's like the first story of a house, and it's like really homey. I know there's like nicer or like nicer apartment complexes with like gyms and pools and that kind of thing.
But everyone in our class lives in Worcester.
Yeah,
And
we
I
live
think
in Worcester.
most
We
of
all
the
live
other
on
residents
different
do.
sides, like
Yeah,
one
we're all
person
kind of
north, one person south,
Yeah.
two people to the east, and two people to the west.
But we,
So like,
But we're all like 15 minutes.
you can get around Worcester in 10 minutes.
Yeah.
This is coming from someone that is coming from like from cities like Atlanta. So like where
Yeah.
there's traffic at 5 a.m. So you can get anywhere in 10 minutes in Worcester, don't worry.
Yeah, it's great. And life in Worcester is like there's nice stuff. There's fun stuff. We've been trying to like go try like restaurants and some breweries together. There's Polar Park, which has the minor league baseball team. It's actually a ton of fun. In the summers and I think early fall, I think they're like finishing up. I like hiking around here. There's some good like chill hikes, and then you're not too far from things like places in New Hampshire or Vermont.
Cape Cod, Martha's Vineyard,
yeah.
Boston. So yeah. If you don't like anything in Worcester, Boston is right there. So
No.
but like no, love where you're coming to. Love where you're coming to. Find fun where you are.
Yeah, which there is.
Yes.
Sure. Yeah.
And we have like a lot of good restaurants, and they're more like mom and pop type restaurants, not chains, which is really nice. I'm a big foodie, so you know I've tried a lot of Worcester food. You need to know about it. I know about it.
Vanessa, what can we answer for you?
Hi, can you guys hear me all right? Okay. Hi, I'm Vanessa. I'm a UMass Chan third year med student, so I really appreciate the opportunity to learn about my school's residency program. The question that I have is if any of your residents have families and what this program does to support residents who have families.
This is a family-friendly residency, I'll tell you. I think a lot of people have significant others. There are residents that have children. There are currently pregnant residents. So we're full spectrum, I think, in terms of what like a family looks like. We're also very supportive of one another, so we're pretty close. I think it was a couple weeks ago, we celebrated one of our our co-residents' second, yeah, they have to be 2 years old now. Yeah, yeah, second birthday. And she's currently pregnant as well. So I think the support is immeasurable. I think whether it's from the faculty and the program itself systemically, but like amongst ourselves, we do help to support, uplift, encourage one another. Having a family, I personally am single, so I can't speak to it, but I think our residents that do have families, they do an excellent job of making it look um, like a balanced, doable thing in residency.
I will say one thing I love about UMass is that our GME office provides some support for people taking parental leave during residency. So our GME actually pays some moonlighting for residents who are picking up extra call because a co-resident is out on parental leave. which is lovely because it means that the resident who's out doesn't have to make up call when they come back from parental leave, which is like, it's just a really difficult time to make up call. We do get some help from the UMass institution as well, and I think that's not available everywhere. But we try really hard to coordinate schedules and to maximize what a resident wants for leave, of course, within the guidelines that we have from the ACGME. Also, lots of people have pets, so if you have a fur baby who's in your family, your fur baby will have lots of friends.
I've cat sat for residents that are on vacation. I'm gonna bring Shahar's cat some food tonight too, because she's away. So, we're just a supportive bunch.
Is it Mary Catherine?
Yes, hi, my name is Mary Catherine. I'm from the University of South Carolina in Columbia, South Carolina. And I want to know for all the residents, if you are not from UMass, why you chose to go to UMass.
Okay, we're up. I did not go to UMass. I went to Toro in upstate New York. I'm a DO. I chose to come to UMass. I actually came to do a sub-I here as a fourth year. I did the MFM sub-I in October of my fourth year, which I wanted to do because I'm originally from this area and I liked things on the surface of the program. But I would say that really the reason that I came was because I loved the people that I worked with when I was here. I thought that the residents that I worked with were phenomenal, and all the faculty really were willing to teach and did a really good job of making me feel like part of the team, even as a fourth year. And it was just like the place that I could see myself being a resident, but I'm sure that's the reason.
I think me and Elizabeth are truly the outliers here. We did not do an away and we went to med school in the South. Um, I went to Morehouse School of Medicine in Atlanta, Georgia. I did not do an away rotation. But I do remember that on my interview day, I just remember feeling very welcome and valued by everyone that I talked to. I knew that this was a great place to get great training, and I knew I wanted strong family planning training, which yes, you can get it in the South, but I I I just knew that I wanted to come to a place where I felt um, very supported in all my ambitions career-wise, and where I will not feel intimidated or scared to seek help. And so that's what I felt on my interview day, even just through the screen. And so yeah, that's why I came here.
Yeah, just to kind of, I pretty much echo everything that was already said by Carly and NA. So I went to CUNY School of Medicine in New York City. I did the summer learning program as a first year med student. And then I did my sub-I with UMass in my fourth year, in MFM as well. And I think the big thing for me in terms of why I chose UMass was the passion that I saw in everyone in leadership, right? Like, this is not just a job. This is a passion, and I felt very inspired by a lot of the people I worked with. I also felt like this was a place where I could learn, and not feel scared to ask questions, not feel scared to kind of explore certain thoughts that I had. I feel like everyone that I've worked with thus far, and even as a fourth year, were very encouraging of my learning, and that's very important to me.
Yeah, I think similarly, there was the strength of the program. So I think we are very good at making very well-rounded residents who are prepared for whatever career path they choose. And so I don't know if I want to go to fellowship. I think I want to be a generalist, but in looking for a program, I wanted a program that trains really strong generalists, but also sets you up if fellowship is your goal as well. And so I think UMass really prepares you for whatever you want to do, is supportive for whatever you want to do, exposes you to like all of the subspecialties early on, and like PAGs, and that was important to me too. And the strong family planning, but then also there's the community side of things that everyone has kind of commented on here about how welcoming and supportive you can tell even before you get here. Because I didn't do an away rotation here. And so, but you can just you can tell programs where people genuinely care about each other and where the faculty are invested in the resident learning and development. And so it's a great place.
I went to school here and I wanted to stay for all the reasons that have already been said.
Thank you so much.
Bianca.
Hi, I'm Bianca. I'm a current fourth year. I go to school in San Antonio, Texas, but I'm originally from Somerville, Mass. I really enjoyed your talk about the Black Maternal Health Week, and I was just wondering if there are any quality improvement projects that specifically target health disparities in Black maternal health patients that are at UMass, like their outcomes.
So faculty are always, there's lots of people doing different things, but one of some of the committees that I'm on, actually, the performance improvement plan for the hospital includes like re so addressing health disparities. And this like the PIP2. In this iteration, we're looking at patients who are speaking language other than English and association of hemorrhage. The previous one was around led to increasing use of interpreter services on labor and delivery. So there's literally an iPad for every single room, so that language services is never, skimped on because of, logistics. So there's lots of work that's happening. I do some things with the doula program specifically then to look at how is this improving our care and kind of connecting the dots. It's great to have a benefit across the state, but if you don't actually get to implement it, then it doesn't mean that much. And then there's other faculty that do quality improvement and implementation research as well.
Thank you.
Mariam.
Hi, my name is Miriam. Can you guys hear me? Yeah, okay. I'm calling in from Philadelphia. I just had two quick questions. I wanted to know how do you guys all feel that the program supports or like promotes your wellness? And then also, like what year do residents typically complete like their ACGME requirements?
Yeah. So in terms of like formally supporting us, I think we mentioned a couple of the things that we do that I really like, which is having like our wellness. The residents are free from our clinical responsibility, and the floor is covered by attendings, and we get to all hang out together and then do something that we like doing. So some of the flower picking activities that we've gone hiking and then gone out for breakfast. And then for residents that don't really necessarily want to do that, there are other ways to accommodate your wellness. For our residents that are on nights and it's not really logical or feasible to do that, we also have our attendings bias dinner. So there's ways to kind of like really be thoughtful and considerate of all of our resident needs. We have personal days also. So, within reason, if you need a day off or a half a day, without needing to explain yourself, that can be accommodated. Residents that need to have their own medical needs met, they can, within reason, work with our our um, chiefs that are in charge of the admin and our PDs to get that met. So those are like the formal ways. And then I guess for informal, I think one of the things I really like about UMass is that our attendings, they're very um, accessible. Like you don't feel there is hierarchy, but you don't feel like you can't go to anyone with a personal complaint. They're always checking in on us. Dr. Kumaraswamy mentioned that like we hang out and they want to know about our personal lives as well as how we're doing um, as a resident. So I think the support is endless on that stand front in the informal way as well. And then your second question about meeting ACGME requirements, I think we don't have any issue really meeting deliveries, whether it's vaginal or C-section. I think same thing with kind of doing our laparoscopic hysterectomies. I think the great thing, we're getting more staff on board that do things like robotic hysterectomy. So it's just more avenues to get our numbers. I think globally, vaginal hysterectomies are typically like the trickier one, but they're again, our fourth years very early on, they met their numbers that have graduated, so that's not an issue either. And then when we have our midpoint and our end of year evals, we're always getting asked, "Hey, did you log all your numbers? Like this is where you fall, you're on track, you're on par." Anyone that's having issues or they're a little bit behind, there's always ways to kind of get you in the OR um, to get caught up. So I would say I don't really even think about it. Like I'm not concerned. Have I logged in a month? No, but I'm not worried that I will not meet my numbers.
Thank you so
Oh
much.
no, I will say that people who we need to pay more attention for at the end of their chief year are just people who were out on a parental leave at some point during residency, but we haven't had anybody not meet their numbers in ages. So even when we're paying a little bit more attention, we still get the residents to cases without a problem. Amberly.
Wait. We wanted to share more
Oh,
about the wellness.
oh, I'm so sorry. Interns, please.
No, I think like everything that Des said, but I really think it's just that day-to-day environment that you're in. Like if you can be doing the same 24-hour shift and have tough, patient outcomes or like have a really rough situation happen clinically, but when you're around people that are supportive and debrief and say, "Hey, are you okay? Was that, hard for you?" Or willing to like say, "Hey, maybe you want to take a minute and process that," or, "Oh, wow, you did awesome." And like the encouragement, like just the day-to-day environment that everyone creates here, like all the way from the faculty down, I think makes such a big difference of how well you feel overall, because a 24-hour shift is always going to be exhausting. There's no way around that, but it makes a huge difference of like the people that are around you and how everyone treats each other and contributes to like make sure that everyone feels well heard and listened to and supported and like
Yeah, and I feel like I find myself like wanting to go to work every day, even after a call shift. And I know it's early and I haven't done that many call shifts, but it's like I'm excited to go and hang out with the people every day, and like leave after a long day, and I'm excited to go back in the morning. And I think that's a huge component of it.
Yeah. One tradition that we as an intern class have done that actually got passed down from the class above us is what we call Intern Tuesday or Turn Tuesday, where we try, or Turn Up Tuesday. We've changed the name a lot of times, where we try to hang out and spend time together outside of the hospital at least one day a week. We as a class are very bad about actually doing it on Tuesdays, but we do make it happen once a week.
It has happened every
It happens every week. It's not always on Tuesday, but the second years now invited us during our orientation to kind of like their last intern Tuesday of the year and passed it along to us and said, "This is something that makes us feel very well and like is important for us to be able to connect when we're all sort of on different rotations in the hospital, to be able to say like, this is how our week is going and like just be there for each other." And so it's something that I know like I have really loved about this year so far and keeps me feeling well.
So well.
Thank you.
I love that so much. Amberly.
Hi everyone, I'm Amberly. I'm currently at Loyola in Chicago, but I grew up in Brookton, Massachusetts. So it's been really great to hear everyone's experience in Mass. I just wanted to know a little bit more about how is feedback given? How do the interns feel about formal feedback? Is there set time set aside, or is it just like maybe instant feedback that residents are getting throughout the time during residency?
People get instant feedback from me and they don't always like it, but I'm gonna keep giving it.
Yeah, I mean, I think feedback is given in the moment. Like often, like as an intern, you're very new to a lot of the different surgeries, and often the attendings tell you in the moment how you're doing, and often after the case they'll let you know a lot of encouragement, basically, let you know what you're doing better, what you could be doing better, what didn't go well during the case. It typically just happens during, but a lot of times after as well. And then we have a new system, my tip report, I believe. Is that it? Yeah, so we have a new system where basically the attendings can send us evaluations or let us know how we did our performance during the surgery. And then we can also assign, I believe, different attendings we can send them feedback as well. So that's something that's evolving this year for us as formal feedback.
Yeah, that system has just launched and we are still getting it off the ground, but so far the participation of the faculty has been better than we expected. So hopefully it's just going to keep on getting better.
That's great. Thank you.
I was just trying to check where I am on the leaderboard. I think I've dropped a little bit lower. I got to do some more emails. I think probably, Sarah, you'll get our last question of the evening. Oh, Sarah, you're still on mute.
Can you hear me now?
Yes.
Okay, great. I am Sarah. I am out in Denver, actually, at Rocky Vista University, but was living in Boston for 8 years before coming out here for medical school. I was curious if there are any current residents applying to PAG Fellowship, and if there are any like research projects they're involved in that are preparing them for that application process.
Hello.
It's like it's like this was planted.
Were you planted in this Zoom meeting? No, I am a third year now, and I'm going to do an elective this December to kind of get more exposure to PAG. And I'm working on a research project right now with Dr. McCarthy and Dr. Madison that I am starting up. It's not necessarily just PAG focused, but a lot of it is about abnormal uterine bleeding. And we're hoping to include some of the population at the pediatric clinic that she works at during the week. So I think like as far as kind of exposure and resources, she's been a really great resource for someone like me, especially since we don't have a formal fellowship at our program, and there are so few fellowships in the country. Just being able to hear her experience, she highly encouraged me to go to NASPAG this past February, March, April. Months are flying by, and that was a really great kind of like catalyst for my interest, or like just kind of cementing that this was something I probably wanted to explore a little bit more. So I would highly recommend, if you can, getting yourself to that, signing up on their website as well to kind of just get the emails, getting their journals, learning about what people in the field are doing and what's happening in the PAG world.
Thank you.
It has been really amazing to talk with you all, from the live questions to the chat, hearing and seeing where you all are coming from. I think that somehow or another we got the word out, and I'm just really thankful and appreciative of all of the avenues that worked to get you here tonight. If we haven't heard from you verbally or by text, when you signed up, you did get our emails. So if you have questions, I think we'll just all put our contact information in the chat. If you have questions beyond tonight, and we hope to see you on the interview trail. Have a great evening.
Thank you all.
Thank you.
Thank you very
Thank
much.
you
Have
for
a good night.
coming.